Today we're doing case study number 5. Susan's friend Lisa is a 48-year-old woman and is admitted to the emergency room. Susan states she has been ill for 5 days with vomiting and diarrhea. She has been unable to take fluids for the past 2 days, and she has no past medical history. Family history is positive for type 2 diabetes, and she doesn't currently take any medications. On physical examination, her blood pressure was 110/80, pulse 96, respirations 22, and her BMI is 34. Skin is dry with decreased turgor. Oral mucosa membranes are dry. Lungs are clear to auscultation. Heart is regular rhythm with normal murmur. No murmur. Sorry, I said that wrong. Abdomen, soft bowel sounds, and no masses. Laboratory tests show fasting blood sugar, total cholesterol is 265, triglycerides is 185, and high-density lipoproteins is 35. Urine-specific gravity is 1.028, and ketones are positive. The physician says or makes a diagnosis of a type 2 diabetes. Reviewing the above history, physical examination, and laboratory data, which of the findings support the diagnosis for type 2 diabetes? So I put the fasting blood sugar of 250.
Yeah.
And ketones.
Yes. I would say.
I put signs of dehydration.
And it said in the book somewhere that, especially in type 2 diabetics, they're always, not always, typically overweight with high lipid profiles. So,
So BMI and lipid profile as well. Okay.
And her genetics.
Yeah.
Correct. History. Second question. This is a new diagnosis for the patient, and the nurse in her teaching needs to describe the pathophysiology of the disease. What are the 5 key points? I think it would be the BMI, the weight, because she would need to decrease it.
Oh, I answered that question wrong.
Is it talking about? I'm sorry. Can you repeat what the question was? I don't have the actual case study in front of me. I just have
the education. It says this is a newly diagnosed patient, and the nurse in her teaching needs to describe the pathophysiology of the disease. What are the 5 key points?
Oh,
That it results from impaired ability of the tissues to use the insulin, as in like insulin resistance.
Okay.
I talked about that. I talked about how type 2 diabetes has a strong genetic component and how insulin resistance and how type 2 diabetics go that way, but I'm not sure if that's the answer she's looking for.
I wasn't sure either, but one of the main points I put down that was with increased weight gain, there's decrease. I thought with increased weight gain, there's decreased receptors. Hold on, let me pull out my note.
I don't know why, but the words, the 5 key points are throwing me off.
Me too.
I mean, I think with what increased weight gain is the inability of the tissues to use insulin, right?
Correct.
like insulin resistance.
Yep. But that's only 3. I didn't have 5. I wasn't sure what the other 2 were.
It says something about that it can lead to hepatic triglyceride accumulation and non-alcoholic fatty liver disease. So, like, it could affect her cholesterol levels by having the type 2 diabetic diagnosis, I guess.
Yeah, but I thought pathophysiology was just related to diabetes, but that would be effects of diabetes, right?
Yeah.
Okay, so
I mean, you could talk about, it talks about how type 2 diabetes doesn't really have the autoimmune destruction of the beta cells. So you could do education on this is the difference between type 1 and type 2. Where
Okay.
type 2 patients still make insulin.
yeah.
Okay.
And in that same discussion, you could discuss like how type 2 is way more common because it accounts for 90 to 90%
Oh, yeah.
of the cases. So that would be 1 point. And then I would say the genetics would be the second or a second point. And then insulin resistance would be a third. I think. Maybe not. Maybe that goes in with our first one.
Mhm.
What do you think about that one?
I was just trying to see if I found anything else in the book. I didn't see anything the first time around, but they do give key points on page 313, but there's only 3. That's why I wasn't sure what she was talking about with the 5 points.
Yeah, and only, like, the last one's for type 2. The second one's, like, type 1.
But if you look in table 50.3, it talks about type 2 diabetes is usually after age 30.
Yeah,
And
that could be on the first part, reviewing, like, the above history
yeah,
and what findings support the diagnosis of type 2.
so, and asymptomatic, which she didn't have any symptoms, but insulin level is usually elevated. That's how we find it, but it kind of puts age of onset and type of onset, which is usually gradual. I think those would be patho, and that would give us 5, but age and then onset, type of onset is gradual.
Or you could kind of state, like, what high blood sugar, like, does to the patient, like, what key things to look out for. I don't know.
I just wasn't sure if she just wanted patho education or she wanted education in general. Because on the thing it says, describe the pathophysiology of the disease. Teaching needs to describe the pathophysiology of the disease and the 5 key points. Because when I'm normally educating, I usually explain what it is, but then I explain what they need to do. So,
Yeah.
I haven't really been utilizing the PowerPoints much because I've kind of been marking in my book and then watching those con videos. So I'm going to open that PowerPoint real quick and see if there's anything in there that we're
missing.
Because yeah, I haven't been using them hardly at all. Which
The
I look at them, but I don't print them off or anything. Oh.
The next part of the question is, what are the important dietary changes the patient needs to make?
And that's all on 1316, on page 1316.
Right, and I wrote them down as well on the.
Okay.
But
Yeah.
decrease carbohydrates and sugars are the 2 main ones, and decrease her weight.
Yep.
But it is on page 316.
Yeah, those are the main ones I put down.
Yeah, me too.
Same. Just going back to that question, that last question really quick.
Uh-huh.
The only things they have that are listed are to discuss genetic and then insulin production and action,
Which we talked about.
diabetes secondary to other diseases. The only other thing that it mentions is the figure 50.6, which is the pathogenesis of type 2 diabetes,
Which is the one I just read.
Yeah.
Yeah.
That's all she has in there.
Okay.
I'd say we met them all.
I think that's all we have. I'm going to stop the recording.